Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
We are pleased to welcome Dr. Michelle Schultz, a renowned and authoritative expert in bioidentical hormone replacement therapy. Dr. Schultz, thank you for joining us.
Thank you for having me.
So tell us a little bit about your medical background.
I am a recovering obstetrician and gynecologist, worked for about 20 years in the field, but was always discouraged because I could answer some questions, but other parts of the field didn't make sense for me in terms of gynecologic things, polycystic ovaries, and things like that. In 2000, I stopped my practice and moved to Colorado, where I played for 3 years, rejoined traditional medicine, but realized there was a big piece missing. And at that point, I found the American Academy of Anti-Aging Medicine and a meeting in Chicago where my daughter lives. So I came for the first meeting there that I was attending, and that was in about 2003. I left that meeting knowing I had found my home in medicine, where I had the answers to the alternative questions and how to heal people on a basic level. And from there, I went into the fellowship. Then I found Body Logic MD and have been ecstatic with this alternative practice of medicine ever since then.
You say recovering. What was your main frustration before you came across anti-aging medicine?
It was very busy, but I was really not finding answers to help the more difficult patients. And also, it was very time-consuming. As an obstetrician, I was working nights, weekends. It was very time-consuming, and there was very little time left for me or my family. And that's really what burned me out. Delivering a lot of babies, which I dearly loved, but I knew I was at the end of it. And I had what at the first point of entry in the American Academy of Anti-Aging Medicine we called adrenal fatigue. The flat fact of the matter was I was overstressed with a traditional medical practice.
Yeah. And so when you first started, at that very first meeting that you went to, obviously that information resonated with you, it was eye-opening. Can you remember what you thought at the time?
Well, first of all, what I really wanted to do was take naps all afternoon. Yeah. So I was missing a lot of the meetings, but I wasn't finding the ones about how to heal the stress response in my body. So I did go home. I did take naps for a long time. I took the supplements. I started eating better. I was always exercising. But then I started to feel better, and I went back to an A4M meeting, and I remember listening to a lecturer. It was Pam Smith, through an afternoon meeting, and I went, I'm here. I'm awake. I'm hearing what she's saying. I'm no longer needing my naps all afternoon. So I realized that I had found answers to my own personal health questions. Yeah. And I kept on looking.
And so how did you find Body Logic and decide to open up your own franchise?
I actually met Patrick Savage at the very first A4M Module 1 that I attended, which was the second one done. I think it's in 2003 at the summer in Chicago. And his brother was lecturing, and so I kind of was aware of them, but that wasn't what was up to begin with. So it took about 2 or 3 years, and I was floundering in my practice, and I was working to try to get my name out in Chicago.
Were you shifting from a traditional practice into an integrative practice?
I had stopped my traditional practice completely and moved from Colorado, where I had a traditional practice at the time, to Chicago to try to establish an alternative practice. And I found it rather difficult because I didn't have the base group of my patients from my traditional OB-GYN practice to move into the alternative.
And this was kind of early on too. What year was that?
2003.
Yeah.
Oh, I moved to Chicago actually in 2006.
Okay.
So I worked in the alternative field trying to get my name out, and I had some friends who had joined Body Logic MD, and when I realized I had to figure out how I was going to live the rest of my life, and I called them, and they said they were Body Logic MD docs and were absolutely ecstatic with their practices. So I called Patrick Savage, the president of Body Logic MD, and talked with him. From there on, it's history. I joined them, and that's been over 10 years ago. and I have an extremely busy alternative medicine practice in Chicago and love it.
Yeah, they're very good at helping doctors like yourself market and find patients who are looking for this type of medicine.
That's correct.
Yeah, so tell us a little bit more about some of the pillars or philosophy of this organization, Body Logic MD. I know they have a bioidentical hormone replacement approach. They require their physicians to go through fellowship training and the modules. Just for somebody who's uninitiated, tell us a little bit about Body Logic.
Body Logic's main thing, and what Patrick has told me a number of times, is I want you to be free to do what you do well, which is be a physician. I want to take care of the part of medicine that's difficult for you to manage, like marketing, like office staffing, and I think they've made, we have probably, 18 flyers about different aspects of our practices, including hormone balancing, or even we're getting into the peptides now. So other ways that you can help patients.
And your online presence and all that business.
Everything.
Right? Yeah.
I mean, I just have loved being part of this organization right from the get-go. The other major thing that has really been good about Body Logic MD is we're a group of 70 physicians across the country. When I have a medical question, I will put it out on the internet and often get 3 or 4 really good responses from people who have expertise that I may be lacking. So we all support each other. We call it fondly the brain trust.
Right. And in this practice and the way that you're practicing now, I assume you're spending more time with patients. You have a smaller patient load. Can you talk a little bit about?
I have a really good patient load. I work basically 4 days a week now. No nights, no weekends, no holidays, which used to be the bane of my existence, trying to keep up with patients on all times of the days. I rarely have what I would even consider a quasi-emergent phone call, but I can easily take care of those via email for the most part. The big emergency today was a patient was running out of a medication. So I can take care of that on the internet very easily for her. So I don't have the difficulties. My practice, I'm not sure how many patients I have. I think Patrick would tell me 550.
Wow.
But, and I have one of the larger practices, I think, in Body Logic. It's a good group of people, well supported by the staff in Boca Raton and my other doctors. I just really have always loved being a Body Logic doc.
Awesome.
And I've been there with them for 10 years now.
Yeah, it really does make a difference when you're not burned out in terms of being able to take care of your patients and focus and listen and, yeah.
I walk out of the door on Thursday evening and I know that I don't have to think about anything until Monday morning again.
Yeah.
Now, I do work on my practice during the weekend. I'm not going to say that I don't, but very little.
Yeah.
And it's also part of my downtime to do that. So.
And which is part of taking care of your own health.
Yes.
Yeah, mental and physical.
Which is part of the main reason why I got into American Academy of Anti-Aging Medicine, which is now the Metabolic Medicine Institute.
Yeah.
What they've done, and it's been amazing watching the evolution of the fellowship. Having started at the very beginning with the modules, Pam Smith was integral in watching the quality of the education and making sure people, the instructors, would give us the information that was out there and keep up with the current literature and give us the references in the literature, which is really important when we go back and our local non-alternative docs would be quizzing us, and I could go back and say, here's the source, in your journal articles that support what I'm doing. Right. And then they don't have much of a leg to stand on in terms of criticizing my treatment of patients. And then it's evolved now into a committee, and Pam Smith is still on that committee, but I have to give her great kudos for the way she's evolved the fellowship. Andy Heyman, in being the chairman of this, I think now has just been an amazing evolution. And I even listened to a lecture that he gave last December and how he has changed that lecture to today, just a few months later. And we're talking about cell signaling pathways in cancer. Wow. We didn't even know this material, even in December, the evolution and what we're getting. So this is cutting edge medicine.
Yeah. Yeah. Now, I know you've gone through the endocrinology modules, but you also...
3 times.
Yeah, right.
Because I can always learn more.
Yeah.
I may be working with hormones on a day-to-day basis. There's always new information coming out, and so my practice continually evolves.
Mm-hmm. And you mentioned peptides, and that's a new offering through AFREM. Can you talk a little bit about your interest in peptides?
Peptides are cutting-edge medicine. This is something that we're beginning to see even in traditional medicine, but what it does is it puts the cherry on top of the hormone and the vitamins and things like that that I can give patients. So this is how we work with the more difficult patients, the one that you've done everything you can with nutrition and exercise and hormones, and now they're still not 100% better. We layer in the peptides, and this is working in the cells, within the cells, and the messaging between the nucleus and the mitochondrion, and how it helps upregulate the mitochondrion and the efficiency of the mitochondrion and keep us away from certain diseases like cancer, particularly, or chronic diseases, diabetes, or autoimmune diseases. So this is really, a friend just asked me, would I rather practice hormones or peptides? And it's like, you can't choose between them.
Right.
These two are hand in hand together in terms of treatment. So it's very exciting medicine in terms of just how to make people feel better.
And
very
talk
exciting.
about something that's going to be evolving. From what I understand, there's thousands of peptides, but only 70 or 80 at this point that are available at clinical use.
The interesting thing about peptides is that they're actually working on designer peptides, and they can use these as carrier molecules to get chemo into cells. They can use these to upregulate your insulin receptors. For the person where I'm seeing Andy Heyman work with the chronic fatigue patient or the mold patient or the Lyme patient, is that you can start getting them out of that chronic inflammatory state and into a healthy state, so that their brains function better and they're sleeping better and their memory is coming back. I can't say enough about this area of medicine. I think it's really going to be critical in the future.
Yeah. So besides the peptides and endocrinology, what are some of the other classes and symposium that you've...
Oh my gosh, I've taken all of them at least once or twice.
Oh, really?
Cardiovascular happens to be a little bit of a passion of mine. I don't see cardiovascular patients, and perhaps I do it more for myself than anything else, but you can help people even on a regular basis by doing some specialized cardiovascular testing and then working with supplements to try to help make their cardiovascular risk a little bit less.
And that's part of the integrative cardiovascular
yes.
module that Dr. Houston teaches, right?
That's correct.
And he's brilliant.
Absolutely brilliant. I think it's wonderful. I remember listening to him talk, and he came back. Now, when we do our lectures, it's 4 two-hour blocks in a day, and he was coming back for the 4th 2-hour block, and he looked at us and he said, "I can't believe you guys are still awake in here." And it's like, I can't believe you're still standing up there talking after 6 hours with another 2 hours to go. Right. No, the information that comes out. What I really love is you're getting stuff that's in the journals, and cardiologists will tell you it's not in the journals. What are you talking about? And I can hand them the paper, or hand them the resource to say, yes, this is studied, and it's in your journals, where the information is. I'm going to tell you neurology is probably a weakness of mine, which means I should probably get involved with it a little bit more. Sure. But when I start looking at what Andy Heyman is teaching us, I think really that's going to be more where the neurology, because he's talking about slowing down the inflammation in the brain, and his lectures alone, I will tell you, are worth the price of admission. So
you seem like you're passionate about learning, a lifelong learner.
Here's where I'll tell you my age. I'm 71 years old. And when most people know how old I am, and they think of their mothers and their grandparents and how they aged, at 71 I have an active practice. Most people are surprised when they find out how old I am. I love what I'm doing, and I don't want to change it. And I walk with pep in my step. I'm still working 4 days a week. I love what I'm doing. I'm traveling. To me, this is why I do what I do. I'm working for myself as well as for my patients.
Awesome. Well, thank you so much for joining us here on Redefining Medicine and our podcast and sharing your story.
My pleasure. I enjoy this branch of medicine so much, and anything I can do to share with other people, I'm very happy to do so.